let's start off with what's Medicare. Okay. Medicare was created in 1965. It was a health insurance program. It originally intended for people 65 and over, but people under the age of 65 who have disabilities, who are receiving Social Security benefits, they also are eligible for Medicare. And it's usually 24 months after they start receiving their disability that Medicare will be offered to them, be kicked in. And it's usually automatic. A and B usually come together, but I'll get to that later. It's also for people who have end-stage renal disease or Lou Gehrig's disease. And when President Johnson signed Medicare and Medicaid programs into law, it became effective January 1st, 1966. And so the first Medicare policies were enforced July 1st of that year. And it's the nation's largest insurance program, and it's currently serving over 43 million Americans. And I don't know if you realize this or not, but when people turn 65, they're automatically enrolled, and people are turning 65, 10,000 people every day. And while Medicare it's administered by the Center for Medicare Services, CMS, it's a lot of protections built in for the consumer. There's a lot of rules for the people who are out there in the public selling the policies to protect the consumer. So it's really a consumer-based product, and probably one of the most notable and just the biggest projects the United States has ever come across. So when you apply for Medicare, Social Security advises people to apply for Medicare 3 months before they turn 65. People don't have to retire to get Medicare. Some people take an early retirement at 62, but they're not eligible for Medicare till 65. But unlike Social Security, when people turn 65, it'll happen automatically. And then Medicare benefits, they can begin earlier, once again, like I said, because of diseases, because of disability, like Lou Gehrig's disease, ALS, and a lot of other debilitating diseases that the government has issued Medicare to. And people who receive Medicare, you may already know this, but it has three main parts to the original Medicare. Originally it was only two, but Medicare Part A is your hospital insurance. So Part A is going to pay for your inpatient hospital stay, but it also covers skilled nursing care, it covers home health care, and hospice care. And then there's Medicare Part B, and that's your medical insurance. That covers your doctor services, outpatient care, and preventative service, including screening tests and vaccinations, diagnostic tests, some therapies, durable equipment, wheelchairs, walkers, drug coverage for outpatient prescription drugs. And then later, actually more recently, I think 2006, Medicare also added Part D, which is the drug coverage, and we'll discuss that a little bit later. So Medicare Part A, let's dig into that just a little bit. People don't have to pay a monthly payment, most people, for Medicare Part A because of their spouse or them, they pay for it during their working years. But there is a possibility that if you work for less than 10 years and you're not fully vested in the Medicare program, you would have to pay a premium anywhere from $252 to $458. But for the majority of the people on it, it is covered. So that, and it's automatic. You turn 65, you're enrolled in Part A, as long as you've paid into the system. And you're also usually enrolled in Part B automatically too, but it's not mandatory. So people can choose whether or not they enroll into Part B. And those who enroll are responsible for a monthly premium. And right now the minimum normal monthly premium is $144.60. That's a monthly, and it comes right out of your Social Security check, or it comes right out of your railroad benefits or other federal retirement funds. And you can sign up for Part B during your 7-month period, that begins the month you turn 65. So 3 months prior, the month you turn 65, and then 3 months past, you have that 7-month period, and that's called the initial enrollment period. And people who don't take Part B during that initial enrollment period, when they're first eligible, they'll have to wait until the general enrollment period to sign up for Part B. And that program, it runs from January 1st to March 31st, but coverage would actually begin July 1st. So you want to make sure that you sign up during your initial enrollment period. It's important because if you are late signing up for Part B, there is a 10% penalty for every full 12-month period that you don't have Part B, that you should have signed up for it. Now, there are exceptions to that. If you already have a part of a qualified program, like your spouse's employment insurance, and you're on their care, and you have something comparable to the drug benefits of Medicare, you're exempt from that. You don't need Part B. But when that ends, like your spouse retires, loses their job, or any reason, you have a special enrollment period. And if you don't enroll in that special enrollment period, you will incur penalties come the general enrollment period. Okay, so let me give you an example. Let's say Sarah turned 65 on, let's say, June 25th, and she plans to retire December 31st. And she has a group health plan coverage with her employer, and her initial enrollment period began March 1st. 3 months before her birthday, and it ends 3 months after her birthday at the end of September. Now, she will have a special enrollment period that's going to begin December 31st when she loses her coverage. Okay? And also, just keep in mind that a general enrollment period is for all the people with Medicare and runs from January 1st to March 31st of every year. So you don't want to be late signing up for Part B. It's important. And most of the people who choose Medicare Part B usually have the premium taken out automatically through their monthly Social Security check or their railroad retirement payment. The federal government retirees that have their premium deducted from their retirement check as well. For information about Medicare Part B premiums, you can also call the Social Security Administration or the Railroad Benefit Administration or the Operation of Personal Management for federal employees if you need more information. Okay. And Medicare, that gives you a lot of choices because not everybody's needs are the same. Not everybody's availability or affordability or their location is the same. So there's no one-size-fits-all coverage for anybody. So we've just talked about, what services Medicare cover and how to sign up for Part B. But people can choose to get Medicare coverage in several ways. The Medicare plan people can choose affects their costs, their benefits, and their convenience, and their doctor, their hospitals, their pharmacy. There's so many choices. So original Medicare, it is available nationwide, but it's also a fee for service. So just about every doctor who takes Medicare is going to take original Medicare. Well, they have to. So otherwise they wouldn't be allowed to take Medicare. So duh, right? So let's hear it for lives. So now there's also a Medicare Advantage plan and lets private companies offer choices for coverage. There's Medicare supplements. And there's just, it's amazing how many, there's 5 different kinds of Medicare Advantage. There's 10 different types of supplements. So there's, any combination of these things can really, you need someone to kind of help you through the decision, someone who can see the big picture and kind of match your needs and wants to what works for you. So original Medicare, once again, it's any doctor, any specialist, any hospital, they all take it. The deductible, here's where it gets tricky, guys. We're talking about the deductible. and we're talking about co-pays. So the deductible and the amount that Medicare must pay for health care, the deductible for Part A is $1,408. And that's for up to 60 days in a hospital. That doesn't cover your first 3 pints of blood. I know that is so weird, but it is. It doesn't cover your first 3 pints of blood. And, there's other different costs involved. And then when you get into Part B, you're paying your monthly premium of $144.60. Then you got your deductible of $198. And then you have a 20% copay in everything Part B pays for. And with Part A and Part B together, there is no cap. So as long as you're in the hospital, as long as you're being treated, it keeps growing and growing and growing and growing. So as you can tell, there's a big problem with having just Part A and Part B. Okay, and then since we're just talking Part A and Part B, you'll notice on your Medicare card, that's all that's listed on your card. So if you just have Part A and Part B, you can use your card to get your health services. Once you get into other forms like Part C, they're going to issue you their own card, and it's going to work like a traditional medical plan. So, and treat your Medicare card like it's your credit card, because it is something that has value. It is something that has your personal identification information on it, and it is something that can be exploited in the wrong hands. So please keep that in a safe place and treat it like your credit card. So the next part of original Medicare that was added later is that prescription drug coverage. And that happened in 2006 with that. So that is a separate piece. There's a premium involved. There is insurance companies involved with the prescription drug coverage. Okay, so we're going to dive deeper into that later. I just wanted to touch on it so you didn't think I was missing something going from one point to another. So, and then, the prescription drug covers, it varies depending on the plan, but every plan must provide the standard level of coverage. So, you'll have that minimum that is set by Medicare, by CMS. And there's co-payments and co-insurances involved in that. So when you're getting into, the drug coverage and you're getting into parts of Medicare, there's always that one thing everybody asks me about. What about the donut hole? Now, the donut hole is not in every policy, but it is a significant thing to think about. To give you an example, the donut hole is always associated with your drug coverage. So depending on what plan you're in, it's deals with your drug coverage. So when you're looking and you're trying to figure out your out-of-pocket cost, if you're in a Medicare Advantage plan, you need to consider the donut hole, okay, or the coverage gap. So stage one of your drug plan, okay, you pay your deductible. There's some deductibles, let's say $435 would be the deductible. And then you reach the coverage limit, which is $4,020, okay? And then you have a gap. And until your out-of-pocket reaches $6,350, you are paying a higher percentage or up to 100%, but there's some good things coming in 21, especially people who have diabetes. In 2021, there is full diabetic coverage through the donut hole. So just good news for you. Okay, so just to give you an idea, I'm going to do another video on the donut hole later, because this is just a quick overview and I just don't want to not talk about it. So, but it's not my goal here today. So we discussed on original Medicare how you have, there's problems. There's all the deductibles and, $1,400 deductible, $352 a night stay after day 60. We're talking big money. So there had to be something to supplement that. And that's where we have Medigap. And Medigap, also known as also known as Medicare Supplement Insurance, okay, that's what it's actually called, is an insurance product. It's offered by insurance companies, but it's in the guidelines set by CMS, by Medicare. So all the plans have an alphabet rating, okay? It's Plan A through Plan N. Some missing in between, but there's 10 of them, okay? And they're standardized. So no matter which company you're looking at, a Plan A is a Plan A. A Plan N is a Plan N. And they have like coverages as set forth by Medicare. Not every company has to offer every plan, but they are standardized so you can compare apples to apples when you look at it. So that is one way to supplement your medical coverage. Okay. Then there's also Medicare Advantage plans. So there are 5 main types of Medicare Advantage plans. And so Medicare Advantage plan is also known as Part C. Okay. And it's not part of original Medicare, so it's like, why have A, B, C, D, and then Part C? But I don't understand the whys behind everything. I just know what they do. So Part C, the first type of a Medicare Advantage plan would be the HMO, the Health Maintenance Organization. That's where you would have a gatekeeper doctor, your primary care physician, and you would have to stay in the network, and you would have to have referrals to see specialists. And there's copays, some little to no copay for your primary care physician, and there's other copays when you're dealing with outside your primary care physician. So that's an HMO. Now it's set up to stay inside the network, but again, if there's an emergency, all HMOs would pay in an emergency outside the network. So that's something you don't have to worry about. There's also a PPO, a Preferred Provider Organization. This is similar to an HMO where you have a network, and that network makes medical use cheaper for you. It's cheaper inside the network, but you don't have to stay in the network. You'd have to pay more outside, but you don't have to stay in the network. So there's more freedom with the PPO. There's more freedom in the PPO, possibly more security in an HMO. So then there's also a private fee-for-service plan. So in that, it's kind of rare compared to an HMO and a PPO, but that's where members can go to any provider that accepts the plan's terms. And it's a private company and decides how much it'll pay and how much member pays for services. There's also a special needs plan. This is for a member who would have some sort of long-term care facility like a nursing home, or is eligible for both Medicare and Medicaid, or known as dual eligible, or certain chronic disabling conditions. And these plans are geared towards that condition. Lastly, there is a Medicare savings account. And these plans have 2 parts. One part is the Medicare Advantage plan, but it has a high deductible. And the other one is a savings account, which Medicare deposits money into to use for your healthcare costs. So I hope that makes sense to you. And that's the overview of Medicare Advantage, the overview of Medicare supplements, and just kind of what you do to bridge that gap in Medicare A and B. So how are you eligible for these plans? Well, in a Medigap plan, you would be eligible the first 6 months after you get your Part B. And that would be your guaranteed issue period where they have to give it to you. Now, a Medigap plan, you could be issued at any time by any insurance company, but you may have to be underwritten. They may look into your health and want to know why you waited, and just it won't be as easy as when you first enroll. And then eligibility for MA plans, Medicare Advantage plans. So first, you have to live in the plan's geographic area. So there is a county or a region area that offers these particular plans. Where I live, our plans are offered in a 3-county area. So that's one like grouping. And you have to have Part A and Part B. And you must continue to pay your Part B premium. Now, however, for some other circumstances, there is help for paying Part B premiums if it is needed and if you qualify. So, and you may have to pay an additional monthly premium depending on the Medicare Advantage plan. So how do they work, right? How do they work? That's what everybody wants to know. So in most Medicare Advantage plans, you usually get all your Medicare coverage in healthcare through the plan. So you don't deal with Part A and Part B anymore. You just deal with your provider for your Medicare Advantage. And most Medicare Advantage plans contain that prescription drug plan. So they would be called MAPDs, Medicare Advantage Prescription Drug. So, and that's the majority of them these days. So, and they have a separate copay for the drugs. There's a deductible and a coverage gap that we discussed earlier today that may affect out-of-pocket costs. So these are all things to consider when you're looking into these plans. So the plan may offer extra benefits too. Medicare prescription drug coverage, as well as vision or hearing, dental or health, wellness programs. People have to see doctors that belong to the plan, and they have to go to certain hospitals to get services. But they have to, at a minimum, cover everything Part A and Part B cover. And they have to cover gaps in Part A and Part B. And they have to cover a minimum, if they are a drug plan, or what a standalone prescription drug plan would cover. So, and even if you're in a Medicare Advantage plan, you need to know you are still in the Medicare program. You still have all their regular Part A and Part B services, and you still have all the rights and protection of a Medicare member. So just keep that in mind and take comfort knowing that you're still in Medicare. You still have all the protections of the law on that. So everybody hears about enrollment periods, right? Like right now, we're getting ready to go into the biggest enrollment period of the year, starting October 15th, and it's going to be going on until December 7th. And that's our annual election period, or annual enrollment period. So generally, there's 3 types. It's not just the one, right? So we know we have the initial enrollment period that we spoke about with A and B, the 7 months, 3 months before you turn 65, the month you turn 65, and the 3 months afterwards. That's your initial enrollment period. So we know we have that. Then we have the annual enrollment period, which is October 15th to December 7th. And this is your chance. If you already have a Medicare Advantage plan, this gives you a chance to change into a different one. If you're in a Medicare Advantage plan, or you're in a Medicare supplement plan and you want to go into a Medicare Advantage plan, this is your time. If you want to change your Medicare Advantage plan and pick up a supplement, this is your time to make switches. Okay? And then all the changes that happen during this annual enrollment period take effect January 1st. So this is all for the 2021 period. And there are special circumstances, of course, where there's a special enrollment period. We brushed on them a little bit. And then there's the general enrollment period. So these are, for people who didn't get their A and B and need their B. They would sign up during the general enrollment period and they get their Part B. It would start July 1st. People who wanted to who signed up for a Medicare Advantage plan, didn't like it, wanted to make a switch, they would do it during the general enrollment period. Okay. So, now again, the special circumstances, the special enrollment period. And this is for someone, let's say they were diagnosed with a disability, and they receive Social Security benefits, Social Security disability benefits. They received them for 24 months. They received Part A, and they declined Part B. Okay, you're saying, why would they decline Part B? Well, suppose their spouse has credible coverage, and they don't need to pay for Part B because they have full medical coverage, they have drug coverage. So they would be exempt from having to enroll in Part B. And then once that spouse either retires, changes jobs, moves, it triggers a special enrollment period where you would be able to sign up for Part B. You would be able to sign up for an Advantage plan, a Medicare supplement plan in the guaranteed issued phase as well. So, and then people who receive a low income subsidy would be triggered into a special enrollment period as well. So there's a lot of reasons for it, and it serves a really good purpose. And let's move on. We talked about late enrollment a little bit, but there's also so people who don't enroll when they're first eligible, they may have to pay a penalty later. And so say you're going to wait till the end of your initial enrollment period to join Medicare, a Medicare drug plan, and you'll have to pay up to a 1% penalty based on the premium for every month you waited. And individuals will usually have to pay this penalty as long as they have Medicare prescription drug coverage. It doesn't go away. So you want to try to avoid penalties. A penalty doesn't apply to people who have other coverage, though. And the other coverage is at least as good as what the Medicare prescription drug coverage is. And that's, again, credible coverage. And some examples of those are the VA's TRICARE or the Federal Employees Health Benefits Program. You wouldn't need that. So, and you wouldn't be penalized for not signing up. So, and there is, these plans, they're not free. They're insurance policies, but there is help. First, the biggest help out there, and by far, is Medicaid. And each states have different rules about their eligibility and applying for Medicaid. So you'd have to check with your particular state and to see if you qualify and learn how to apply. And people can also be a thing called dual eligibility. If you have Medicare and your full Medicaid coverage, most of your health care costs will be covered, and there'd be little out of pocket. There's also Medicaid saving programs, which they're for people who have a higher income than people who qualify for Medicaid, but you have to be eligible for these programs, and it's determined by your income and resource level. So it's like a sliding scale. There's 4 different tiers and 4 different levels of help and aid involved in that. So there's the Medicaid saving programs, which we just spoke about. And then there's a program called PACE. And that's a program for all-inclusive care for the elderly. And it's a Medicare and Medicaid program, but it's different. It helps people with their cares and needs in their community instead of them having to go into a nursing home or other care facility. So with PACE, you have a team of healthcare professionals working with you and your family to make sure that you get the coordinated care that you need. And usually that care is it's for a small number of people, and so you really get to know the people who are on PACE with you. And when you enroll in PACE, you're also usually required to use a PACE preferred doctor. So some states have these programs and they're limited income resources, and they have other sources as well. But it's varies so much by state. I just want to kind of stick with the general overview. So again, it comes down to eligibility, right? You can only get what you're entitled to, what you can prove. So certain groups of people are automatically qualified, and those would be people who are dual eligible, people who have Medicare and full Medicaid benefits. They're automatically eligible. And then people who receive supplemental security income, which is SSI. They would also be eligible for these programs, these low income subsidies. Now, people who get help from Medicaid paying their Medicare premiums, and people who belong to the Medicare Savings Program, they should file an application with the Social Security Administration with their state to find out if they qualify. So if you think you need help and you think you're within the limits of the federal poverty level, yes, by all means qualify. By all means find a reputable agent to kind of guide you along, to help you out, because we are here for you. That is why we are supposed to be doing our job, is to help the public. So we covered a lot today, and this was just really a high-level overview. So this was just the basics about Medicare. So we learned it's a national insurance program. It's administered by the Center for Medicare and Medicaid, CMS, and it's for people who are 65 and older, and the people who are under 65, who are receiving Social Security disability or receiving supplemental insurance. We've learned a lot. And so you've learned about the choices that you have. You've learned about the coverage basics and how they work, including original Medicare. We've learned about Medicare Advantage, including HMOs, PPOs, and other types of Medicare plans. And finally, we learned that all programs like Medicaid and Medicare savings programs, and they're there to help with those out-of-pocket costs. And most importantly, you'll know where to get the information. So it's an easy number. If you need more information, 1-800-MEDICARE. You can go to medicare.gov. You can go to your state health insurance assistance program, SHIP, and you can find some really people who are there who want to help you. If you have any questions, if you want to contact me, I would love to discuss your needs. I would love to take a look at your policies, see what's going on in the future for you, see what your thinking needs, budget, see where I can help you. You can either get me by direct message through Messenger, or you can click my calendar link below. If you're watching this on the replay, I encourage you to do either one of those. And that's all I have for today, and I don't want to take up any more of your time. So I just want to end this, let you know that I am here for you. I am your advocate, your agent.